Welcome back to Psychedelics Today. This is Joe Moore coming at you from Breckenridge, Colorado. Today on the show, we have Dr. Mike Hart. He is a physician living in Ontario, Canada, and has a lot of really interesting things to say about cannabis, psychedelics, nutrition, and more. He's one of my favorite Instagram accounts, actually. Definitely worth a follow if you're on Instagram. Really interesting insight into the COVID situation and a lot more. Like there's a lot that goes into creating a healthy person and a happy person. So he's kind of got the gamut covered. And I think you'll dig this. I was really happy to have him on. I think I've been trying to get him on for maybe a year and a half now. Former guest on Joe Rogan's podcast and a number of others as well. So I think you'll dig him. You'll probably be hearing more from Dr. Mike Hart in the psychedelic space in the near future. Primarily, he's known for his work in the cannabis world, helping people figure out how to introduce that and the compounds more healthfully into their lives. Because, as many of you should know, cannabis can be used as a legitimate medication for certain indications. So a very helpful podcast here, I hope, for you. And check him out. You can see his website at mikehartmd.com, MikeHartMD.com. We have some really interesting education coming up on July 9. We kick off a 8-week live supported course for clinicians and therapists called Navigating Psychedelics for Clinicians and Therapists. In there, we cover tons of great material, essentially teaching you as a clinician or therapist how to deal with this coming field, getting you ready for clients coming to you to talk to you about their trip to Peru or their situation at a festival or with some friends in the mountains or something. So there's a lot to learn in this field. This is not something you can quickly learn over a weekend, how to deal with this stuff as a professional, not even as a guide, but as somebody that might be dealing with the fallout from it or just helping someone ground a little bit so that they can get a little bit healthier and better regulated. So check us out, check the class out at psychedeliceducationcenter.com. We think if you take the class, you are going to really appreciate it. We've had nothing but stellar reviews so far from our students, and you can read some of them up on the website at psychedeliceducationcenter.com. One more word from a sponsor and on with the show. This episode is brought to you by Mudwater. Mudwater is a coffee alternative with 4 medicinal mushrooms and adaptogens. With 1/7 the caffeine is a cup of coffee, you get sustainable energy without the anxiety and jitters of coffee. Kyle and I have had about 3 months worth of Mudwater, and we really like it a lot. Mudwater has really helped me slow down my coffee consumption, and I feel great after drinking it. Another thing I like about this company is that they donate a portion of each month's revenue to MAPS. Check them out at mudwater.com, mudwtr.com. Use the code psychedelic at checkout for 15% off. Hi, everybody. Welcome back to Psychedelics Today. Today on the show, Kyle and I get to talk to Dr. Mike Hart out of London, Ontario, about 2 hours out of Toronto. And really excited to have you here, Doctor. Do you go by Dr. Hart, Dr. Mike? What do you like?
Dr. Hart, Dr. Mike, whatever you guys want to call me. It's all right. Good.
You got it.
I'm just happy to be here.
Happy to have you. I've been following you online for a few years now on social, and it's been pretty cool to watch your development. And even a year ago, I think just about a year ago, you were on the Joe Rogan Experience podcast, which is the biggest podcast, I think, in the world currently. So yeah, really excited to have you just in general. But yeah, excited to expand on cannabis, ketamine, and all that kind of fun stuff.
Cool. Yeah. I mean, that was obviously an honor to be on Rogan's podcast. I wish I wasn't debating Alex. Wish I was on there myself. I think it would have been a little bit better. But yeah, I'm excited to be here today too and talk about, all things that, we didn't get to talk about on the Rogan podcast, like, maybe a little bit more about cannabis, maybe a little bit more about ketamine on the psychedelic side, and, whatever questions you guys have prepared.
Yeah, great. So maybe let's start med school. Where'd you go to school?
Sure. So I went to school in Saba. So Saba is actually a really small island in the Caribbean. It's right next to St. Martin. So I was there for 2 years. Then I did my clinical clerkship back in Canada. So mostly through Dalhousie in Nova Scotia and through Memorial University in Newfoundland. And then from there, I came to Ontario, which is where I am now in London. And I did my family medicine residency at Western University. So I was there for 2 years and started practicing on my own. It wasn't until actually just about 8 months after I started practicing is when I started prescribing cannabis. So it was really short period of time. It was about 2017 when I started my own clinic, ready to go. And I've been here now for just over 3 years.
Cool. Was it difficult for you as a physician to make that leap to prescribing cannabis? Did you have to do any special training, or how did that work for you?
No, I mean, basically, I got into cannabis because, I saw it was just like a fantastic alternative to opioids and sleeping pills and to, a lot of other medicines. And, because of that, I wanted to get into it right away. So like I had graduated in 2013, 2014, they introduced this MMPR system, which made it much more easier for physicians to prescribe cannabis. So, in 2014, again, I started right away with the cannabis. Didn't have to do any like extra training or anything like that. I mean, all the training that I've done, all the knowledge I have on cannabis is really just self-taught. I'm just like a PubMed addict, just go on there and kind of like all day, every day, and that's where, that's really how I've learned, quite a bit about cannabis. And then also too, seeing patients, sometimes I'm seeing 100 patients a week. Like obviously you're going to pick up a lot from seeing patients and from all the stories and feedback they have given me.
Well, it's really great. And it's, as an outsider, I haven't had a medical card yet in the States, but I was there when my girlfriend got one. It was a really interesting conversation with the doctor. And it was framing cannabis very differently from how, I had really seen it before, suggesting vape over smoked, edibles, that kind of thing. And it was just an interesting conversation about terpenes, and the science is still really young, right? Like the science has been halted, and there's just this new lawsuit. Did you see this lawsuit yesterday that MAPS mentioned on their Twitter or Instagram?
I think I might have missed that. So bring up to speed.
So a group called the Scottsdale Research Institute outside Phoenix does cannabis research, and they actually sued the U.S. federal government for blocking research on purpose surrounding new grows. And
okay.
Yeah, so there's an active lawsuit against the feds here, at least.
Interesting.
Yeah.
Interesting. Yeah, I mean, I'd like to get into that a little bit more. I mean, I know, like, I'm not a conspiracy theorist by like any stretch of the imagination at all, but I do believe that there were definitely, and there probably is still, a lot of ongoing, lobbyists and people who are not trying to, or who are trying to deter cannabis research for their own benefit, because they're afraid, that the medicinal aspects of cannabis, may in fact take over their business, their pharmaceutical drugs or whatever it is that they're worried about, that cannabis may take over. And again, I don't want to go off too much on this, but this is what happened too in the early 1900s. When cannabis was coming out, it would have been a great textile, but that would have just shut down paper. All the paper mills would have had to shut down. So they made some stuff up, and they made sure that people made laws to make sure that people couldn't use cannabis, or hemp, as a textile. And again, like, I still think some of that is going on days right now. And again, it's not a conspiracy. It's people that are really trying to lobby against cannabis to make sure that people aren't researching it. It's absolutely ridiculous how little it's been researched so far to date. So I'm definitely going to follow up, on that article. And, just on that point, because I always like to mention this when this comes up, is that we are in the infancy of research, because there's over 140 cannabinoids in cannabis. And, the only ones most people really know about are THC and CBD. And, 4 or 5 years ago, no one even knew what the hell CBD was, right? So up until, 5 years ago, we had one cannabinoid that the general population knew a little bit about. And still today, very few people, know much about CBD and about the other cannabinoids. So, we definitely need to step up the research, because there could be, other cannabinoids out there that are just as effective as CBD for a variety of different conditions. The one that I'm super excited about the most is THCV. And the reason is because THCV has been shown to decrease appetite. And we all know being overweight and eating too much is a huge issue in North America. I think it's very close to, taking over cigarettes as one of the most preventable causes of mortality and morbidity. Is lack of physical exercise and poor diet. So I think that if we can get THCV on board and get people's appetites down, that might be something that can be really effective for a lot of people. So really great, really, really great question. And I'm super excited about, the research that's going to come out.
Yeah, it's interesting that you say that there isn't much cannabis research. And, I've done just a little research. I used to be more into researching cannabis versus psychedelics now. But I think it's really interesting that it seems like sometimes there's more actual research on psychedelics right now, especially within clinical trials. And you're not really seeing that with cannabis. And it's just so interesting to see that cannabis has a medical program and recreational, and there's really not that much research being done on those clinical levels. It's really fascinating.
You're right. I mean, there's still very few randomized controlled trials on humans in cannabis. And that's what, people are waiting for. Like, that's what the doctors are waiting for, so that they feel more comfortable prescribing cannabis. And unfortunately, even though I do see more research, and some of the things are being lifted so that researchers can actually do their job. Even though I see some of that, we still don't have very many randomized controlled trials on humans, and that's what people want to see. We do actually have some pretty decent retrospective studies, epidemiological studies, mechanism of action, animal models. There are quite a few things out there. There's definitely some good case series and case studies out there on humans, but we don't have too many randomized controlled trials, and that's what we're really looking for. The only condition where we have probably several of them is for Dravet syndrome, or for seizures disorders. There's 5. There might actually even be 6. There's either 5 to 6 randomized controlled trials on that, but we have very little on many of the other conditions. So, I think that's where the research needs to go now. It needs to go on humans. We need more research in humans right now.
Why do you think there hasn't been much? Do you think because it's a plant, it's not a pharmaceutical, and it's kind of not going through the same process, or?
I think that's definitely part of the reason. I think so too, that, the studies, to do like a randomized controlled trial, unfortunately, is fairly expensive. So you're going to have a lot of patients involved. You're going to have the medicine, and then you're going to have the scientists and researchers involved as well. So there's quite a few people that need to be remunerated for their time, and it takes quite a bit to do. So, a lot of and who is going to do that? Obviously pharmaceutical companies are not going to fund it. So it's going to have to be funded, potentially by someone in the cannabis industry, or the best would be a third party industry would be to fund that, and then that way you have no biases going into the study. So I can't give you a better answer than that on it, but I just hope that the issue resolves sooner than later.
Yeah, I would really like to see this move along. So what do you think are the most common indications you'd be prescribing cannabis for? Or does it kind of jump all over the place?
Yeah, no, that's a good question. So I think the biggest ones are chronic pain and insomnia and mental health, those 3. And those 3 go hand in hand together somewhat. And not everyone who has chronic pain has insomnia and a mental health condition, but a lot of times those 3 do go together. So just talking about chronic pain, it's really good for people understanding how cannabis can treat chronic pain. So CBD is an anti-inflammatory. So CBD is really good for people who have inflammation. So anything with the name itis in it, so arthritis would indicate an inflammatory condition. Rheumatoid arthritis is inflammatory condition, so is osteoarthritis. So CBD can be really good for those conditions because it reduces their overall inflammation. Now, if you have, say, like neuropathic pain, you have something like sciatica, or you just have, kind of some strange nerve pain that's relatively undiagnosed, some people find that THC in those instances is going to be much better than CBD. And the reason for that is because when you have THC on board, you have a dissociative effect. And the dissociative effect is, in fact, what can be effective for reducing overall pain. Because if you have pain in your knee, the pain, it's not, your knee isn't telling you that you're in pain. It's your brain that's telling you that you're in pain. It's a signal going from your knee to your brain telling you that you're in pain. And that's where THC can interfere with blocking that signal. And that's why a lot of patients will say to me, I can still feel the pain, but it just doesn't bother me anymore, right? And the reason is because, they're getting the pain reduction, but they're also getting that through that reduction and that signal that's telling them that they're in pain.
Great. Yeah, I've got a really good friend who broke her back real bad, and she's using cannabis orally twice daily, both CBD and THC. And it's helped her get off of, nerve pain meds and opiates. So it's been pretty incredible. I've been using this stuff for a long time, and it's helped my body pain quite a bit. I don't have any, as far as I know, neurogenic pain, just mostly inflammation and injuries. So it's been pretty extraordinary. And it's cool to know that that's a really common thing you do. I had a conversation with my physician here, non-cannabis doc, and told him I was using edibles to go to sleep. And he had a fit on me. And just saying there's no research. We tell people to use valerian root and melatonin. I was like, well, come on, man. We've been using this stuff for a pretty long time. I think we know enough to use it for sleeping. At this point.
Yeah. I mean, it's definitely, again, one of the bigger indicators as to why I use cannabis. And, it's one of the more successful indications for cannabis use. And, most people will find that they will need some THC to sleep at night. There's a small percentage of people. I mean, I remember I did a poll on this on my Twitter. So again, this is just a Twitter poll. It's not something that's been peer reviewed. But about 15% of people responded and said that, they can get away with just CBD only. And, that's probably pretty accurate. So you're, less than 1 out of 5. Most people do need a little bit of THC. So again, we're not saying that, you can't sleep just with CBD only. Like maybe you can, if you're using a product that's like super high in myrcene, maybe, a very sedating terpene in CBD, and maybe your issue's not too bad. You can fall asleep. But for most people, they do require a little bit of THC. And some people find, a little bit of both is good, a little bit of THC and CBD. And, that's something that you need to tease out yourself and you need to experiment with. Because CBD for some people can be a little bit activating. They think that, it can rev their brain up a little bit. Yeah, I totally get it. I mean, it does increase BDNF, right? Brain-derived naturopathic factor. So, that's the same thing that increases after you exercise, which is part of the reason why you feel like a little bit high. And when I mean high, I mean feeling well. I don't actually mean, high in a dissociative sense. So I understand, where you guys are coming with that.
Cool. Kyle, maybe share your story there with CBD if you don't mind.
I actually had another experience the other night with it. I've taken CBD. We had some samples sent to us by Bluebird, and I've tried some other samples, and really not much. I would take anywhere from like 20 to 50 milligrams. And recently, a friend of mine that lives up in Vermont has a small CBD company. Well, I guess it's actually getting bigger now. But his products have affected me in a such different way. And so I have to preface this by, this is post-ayahuasca. So I went down to Soltara in January, and I haven't been using cannabis or anything besides CBD. And the first time I took CBD after my experience at Soltara, I come back with these visions. Like, it's so activating for me, and it kind of will put me back into these states. And so one night, Joe and I were in Vermont, at our breathwork teachers doing some stuff, and we were trying some of this stuff out. And I woke up in the middle of the night, full on, back in my ayahuasca experience, having visions and kind of seeing the fractal patterns, and started to actually do a lot of trauma processing. And it was very intense. Like we took it at like 10 or 11. I woke up at like 1:30, just fully back in that experience. And I remember waking up being like, what the hell is going on right now? And it actually just happened to me the other night, 2 nights ago. I haven't used CBD in a little bit and decided to just try to take some to get some good night's sleep. Again, woke up with the strangest ayahuasca dreams. It's like, and again, I don't know what's going on there. It's almost as like plants are communicating to me when I'm taking that in. I come from more of a shamanic background in a sense, or worldview. So I think I have more of a different relationship with cannabis and plants than just kind of taking it as a medicine. And I'm just trying to like relieve this. Sometimes there are these other processes that unfold with me, but I don't know. Has anybody ever reported any similar things or have any wacky reports from CBD use?
Well, I don't know if everyone would be brave enough to share their story if they did have experience, or would be brave enough to tell people that they did ayahuasca and then CBD. So I think that would kind of negate, most people from sharing that with me. But on that note, I mean, definitely, I've heard of people, and this is a good point too, because I did make this mistake on Rogan, so I'm kind of happy that you guys are giving me the platform here to correct it today. So I said, CBD isn't psychoactive. So CBD is psychoactive, but it doesn't get you high. So it's not psychoactive in the sense that it causes a dissociative effect. Like coffee, which is what I'm drinking right now, has caffeine in it. Caffeine is psychoactive. It does change, how you think, right? If you take caffeine, you can definitely feel it. It's a psychoactive effect. If it didn't have an effect, no one would be drinking it, right? So, there actually is, a psychoactive effect to it, but it just doesn't make you high. So I just want to make that point. Now to your own, personal experience. I mean, it's really hard for me to comment on this. Like obviously, you probably had a very, very profound experience on ayahuasca. I mean, everyone does from what I understand. So what I would say is that when you had your experience, you had a huge change in your perception, in your shift, not just in the moment, but now probably, so again, not just acutely, but now probably chronically as things are, as the months progress. So because of that, I think that perhaps your perception as to when you take in medicines, even though you may have taken CBD before, the ayahuasca, it may change, how you perceive that medicine because you've had this experience. And then on the other hand, on top of that, there's no evidence, again, indicating that CBD causes any type of high or anything like that. But for you, in your particular case, maybe when you get the effects of CBD, it can, reduce your anxiety to a level and also to just change your overall, your perception and outlook to a point where like you're having this intense experience that other people may not have experienced. But that's just something that's like completely individual to you, and that would be my sort of perception on it and what happened. But I just feel that some of your physiology may have changed. You've taken the ayahuasca, and now because of that physiology has changed, when you get CBD on board, your physiology is going to have a different response than what you had you not done the ayahuasca. But again, I will say though that like I think you're having a very atypical experience, so I don't think that most people will have the experience.
Yeah, I feel very atypical. And then again, I kind of come from more of like a plant spirit background, and that probably obviously plays a role into how I view some of this work. But you also pointed out something that's really interesting is CBD relaxing, and thinking about going into certain experiences, day to day, just kind of going about my day, and then maybe the anxiety is there, but I'm just going. And it's like, finally, when I get to relax and go inward, I mean, we know this from breath work, is that If you can just create the container to go inward, all that experience is there. Like there's plenty of people that have had psychedelic experiences by just breathing. I've definitely had kind of those somatic or these like psychedelic experiences by just doing somatic work, right? And so for our framework, I don't know, maybe Joe, it resonates with you. All these experiences are inside of us, and here's vehicles to get there. And so maybe relaxation, just turning inward, it's all there to begin with. And so, yeah, just kind of pointing out, I do like that approach of being able to relax and actually go into it. You're able to access a different state.
Yeah, no, that's a really good point. Like it's just giving you the ability to like access centers in your brain that are otherwise, blocked because of anxiety or whatever it is. And when I say anxiety, like I don't mean that to say that like you have anxiety. Like that's not what like I'm saying. I don't think that there's anyone who's like devoid of anxiety. When someone has like an anxiety disorder, then you can say, okay, like their anxiety is affecting their ability to work, their ability to work out, their relationships, like it's affecting their function. Like then you can maybe say, someone has a disorder. But we all, 100% of the population suffer from anxiety in some type of way, like guaranteed. And like every single day, I don't care who you are, you're at least experiencing a little tiny bit of it. So, getting something, getting a medicine in you that's maybe taking even like that background anxiety away is going to allow you to access conscious states that you're not able to access otherwise without these medicines. So again, it's not like the medicine, it's doing something special other than the fact that it's alleviating anxiety to a point where you're allowed to access these pathways and this consciousness that you wouldn't have accessed otherwise.
Totally. I want to backtrack a little bit. You're talking about the combination of CBD and THC. I've always heard that THC like really potentiates CBD. So what's your take on just taking CBD without THC versus like, if you live in a state where you can get medicinal or recreational, you can get these different ratios?
Yeah, no, that's a good point. So, if you have an aversion to THC and don't like being dissociated, obviously CBD is the best, thing for you. Why would you take CBD purely on its own? It can again be really good, just for relieving pain. It can be good for relieving, a lot of anxiety as well. But coming to the point, what happens if you use, some THC in combination with the CBD? So I wouldn't necessarily say that like THC potentiates the effect of CBD just because, the fact that when they're both on board, like CBD does negate some of the effects of THC just because of the fact that it's going to be an antagonist of THC at the CB1 receptor, or it's an antagonist of the agonist of the CB1 receptors. Specifically, is what it is. So because of that, basically going to block THC from attaching to that receptor. So, I wouldn't say that they, potentiate each other, but working together, is something that definitely you could say, Dr. Ethan Russo, the gentleman who stated that, there's something called clinical endocannabinoid deficiency. So, just like we can be deficient in vitamins, or hormones, we can also be deficient in cannabinoids. And the three conditions that he's associated with this have been fibromyalgia, IBS, and migraines. And the point of this is that, coming back to your question, is that I do believe that in many of these cases, adding a small amount of THC to the CBD is not necessarily going to, potentiate the effect of CBD, but what can happen is you're going to get that more of that entourage effect. So, if you're taking a product that's say like a CBD isolate, and again, there's nothing wrong with CBD isolates. Some people do very, very well on CBD isolates. And if you're one of those people, fantastic. But you asked about CBD and THC. I think, the question there is there an entourage effect? Is there something that's going on that can be a further benefit to the patient? And I do believe there is. So, if you are taking CBD and you want to introduce THC into your system, what I would say, first of all, is don't use more than 2.5 milligrams. And the reason I say that is because generally speaking, anyone using 2.5 milligrams or less with THC they don't experience psychoactive effects. It's not going to be 100% for people, but that is the general consensus. People do not experience psychoactive effects from 2.5 milligrams of THC. So if you're taking CBD, you can definitely add that amount into it, and you can potentially get further benefit from the entourage effect without experiencing psychoactive effects. But again, another reason to add THC and CBD, like there's some people, like we talked about pain earlier. So might be some people that have arthritis, but they also have sciatica, right? So they need something that treats arthritis and they need something to treat sciatica. So they get both on board. So, adding THC, to CBD again can be effective for that. The other thing with adding THC is you can do it slowly. So if you're already using CBD, add the 2.5. Like I said, the 2.5, I can almost promise you, I don't want to say guarantee, but it's not going to cause any type of psychoactive effects. That's what we're seeing. If you feel like you can get further benefit from it, then just add 2.5 milligrams. There are people who go even up to about 10 milligrams of THC and CBD and say they don't really get any type of psychoactive effect from the THC. So, I do think that it's important to know how you're responding both to CBD only and also to how you respond to just a small amount of THC and a little bit further.
Thank you for that. That's really good. I actually took a note earlier to ask you about entourage effect, and it was hopefully we were going to be able to talk about entourage effect with cannabis. But how do you, related to other plant psychedelics, can you comment on this idea of entourage effect? Like, from my understanding, there's minimal data about entourage effect in other drugs. Like, people want whole plant mushrooms and whole plant iboga to be proven better, but there's no real firm data, right? But how do you usually approach that?
I mean, it's one of these things where, like, there's kind of two different approaches. There's this very, very basic, simplistic approach that we can almost, apply to, like, a very simple analogy would be like nutrition in terms of like the egg. They say that nature gave us the full egg. You should eat the whole egg. That way you're getting, not just the nutrients from the egg white, and you're also getting the nutrients in the yolk, which actually has significantly more nutrients. The point being is, some people feel this way about cannabis. I think that both people are right. I don't think that there's anything wrong with isolating a cannabinoid if you only need that specific cannabinoid, and if that cannabinoid is helping you. Meaning that, like, if you're taking pure CBD isolate and it's helping you, and you don't feel like you need any further benefit, why complicate the process? Why try and fix something that's that's already working? Just continue to use it. I don't see any issue with that. Some people get up in arms about, the pharmaceutical companies are just going to try and make this into drugs and all this different stuff. And, like, if someone isolates, one cannabinoid and it's working very, very well, let's continue to do that. That's an intelligent thing to do. Okay. That's how I feel about that. But the other point is that, there is some, again, very limited data on this entourage effect. And some people do feel that you need all of the plants in one to work. And is it something like, again, comparing it nutritionally to, like, eating the whole egg? Do you need the whole plant to get all of the benefit, to get all the nutrients, all the cannabinoids, all the terpenes? And, some people feel like that as well. And for those people, I agree with them. I do feel that there, are some people who do benefit from the whole plant. And then, I'm very happy to ask this question too, because comparing it to psychedelics, like if you take, for example, psilocybin, and you look at mushrooms as a whole, and I'm sure, a lot of your viewers are probably familiar with Paul Stamets and what he's done. So, Paul Stamets, for example, he's a big advocate of lion's mane. He's a big advocate of reishi, chaga, other things that are part of the mushroom plant, right? These things are not psychoactive in the fact that they're not going to cause a dissociative effect. But is it an absolute wonderful thing that a lion's mane has been isolated on its own? I think it's a fantastic thing that lion's mane has been isolated on its own. And now people can use a medicine that is not going to cause any type of any psychedelic effect, that can definitely give you a little bit of a boost, right, overall. Now, comparing this to cannabis and the entourage effect, he did put out an article. I don't know how recent it was. It might have been a year old now, but he said, combining psilocybin, niacin, and lion's mane, is an effective combination, right? So he believes that there is an enhancement effect of using psilocybin, the dissociative psychoactive effect in magic mushrooms, and with lion's mane, a non-dissociative mushroom, and getting further benefit. And just so you know, the niacin is linked in there because he believes that by opening up your blood vessels and causing vasodilation, you're going to get more blood flow to the brain, to the head, and more delivery of the medicine. That's my understanding of it anyway. So, and just on that note too, two other things that can do that have been shown in data: blueberry extract, surprisingly, and grapeseed extract can both increase blood flow to the prefrontal cortex. So I'm not sure if that can enhance your experience like, say, the niacin can, but maybe something worth looking into. But coming back to the question, I mean, that's the way I see it. I mean, I see that I think that someone can take lion's mane on their own and get great benefit, and I think that's awesome. And then do I think that, stacking all the mushrooms together, reishi and chaga and turkey tail, and maybe even adding the psilocybin in it, do I think that's a good idea too? Absolutely. So I'm on camps with both boards. And it's not that we have to choose one side or another. Let's just do what's best. And there's definitely situations where using the whole plant is best. There's definitely situations where just isolating is best, both for psilocybin and for mushrooms and for cannabis.
Yep. Science has a series of provisional truths. We need a lot more research dollars here. And this is going to be an ongoing project for decades, many, many decades. So yeah, thank you for that. And Paul Stamets kind of launched that discussion about stacks at 2017 Psychedelic Science. And since then, he's actually filed a number of patents to, I think, protect it so that nobody's going to go on that. And on one of them, he actually I think he added CBD on one of the patents, which is interesting. And I think he might have dropped lion's mane or cubensis, which is really interesting. So people can easily Google Paul Stamets patents, psychedelic, and you'll find that stuff. Yeah,
I think the niacin, I've heard him talk too. I think he might have mentioned it in Fantastic Fungi as a block of if you're microdosing it, so you end up not taking a lot because then you'll get the niacin flush. So it's kind of like a protective layer for microdosers as well.
Okay. Yeah, I for whatever reason, I just don't mind the flush. I kind of like it. Some people.
You've had some big ones.
Yeah, I know people that actually take it and go into the sauna because they enjoy how it feels.
I had to lay down in bed for a good 45 minutes. I thought I was, it was worse than some trips I've had. I was like, this is not good. I just got to lay down and just not move for a while. It's really physically intense at times. Yeah. But my father loves it. He loves the flush. He does it just to feel different, I think.
Yeah.
So you said typically you're prescribing cannabis for insomnia, pain, and then you also said something about mental health. And I know probably anxiety fits into that. Coming from I guess the biochemical model, it's we understand maybe how cannabis is helping to decrease anxiety, but I'm also thinking about from a mental health standpoint, I don't know if you're too familiar with Innate Path in Colorado, but using cannabis adjunct to therapy, and could you see any benefit on that front versus more just taking cannabis to relieve anxiety because that's just the effect of the plant or the medicine versus actually using it as an adjunct? And I know you said that you also work or prescribe ketamine. I'm not too sure how you use that, but yeah, just this idea of actually using cannabis with therapy to actually maybe help to maybe work through stuff and actually help minimize anxiety long-term.
Yeah. So I think there's, a couple kind of questions you had in there. I think one question kind of is there's sort of a maybe not in the scientific community, but there's definitely a general consensus out there that CBD can be effective for anxiety. Although I think it's starting to come in the scientific community as well. Just again, lack of human studies will always deter scientists from actually saying that. But I think your question kind of relates a little bit to like depression, if I'm correct. It seems like, that's kind of what you're asking about. I feel that the CBD can help with depression as well. Depression is harder to treat than anxiety. Anxiety can actually be treated pretty well with exposure therapy. But, exposure therapy is not something that's fun. Again, what is exposure therapy? Basically, whatever you're afraid of, you expose yourself to, and then eventually over time, you'll be less afraid of it. That's generally how exposure therapy works. And on the note on CBD and mechanisms of action and talking about that, there was one study, again, this was unfortunately done on rodents, so would like to see it done on humans again, but it showed that CBD can actually decrease learned fear. And it did so in 3 different ways. So that's something that I think that, a lot of people should know about. And the reason is because, a lot of depression and a lot of PTSD, things that are related to mental health, especially PTSD. I mean, PTSD is all learned, right? Nobody is born afraid to go to the grocery store. That was learned. No one's born afraid to leave their house. That was learned. Right? Like you're not born because there's a lot of guys I see vets, like they'll leave their house like 5 to 10 days a month, like maybe even less, because they're afraid. And the other thing too, that I like to like teach to people about this, and some people see this as like controversial, but I think it's the best way to look at it, is like you should actually try to deny your trauma. Because when you and I'm not saying deny trauma from the fact that this didn't happen to me. Obviously that's ridiculous, and that would be detrimental to your health, and that's not a good way of thinking. But deny the fact that it's going to have a significant impact on you, because we all know people who have had a minor amount of trauma and they carry it with them absolutely everywhere. They're stuck. They can't get anywhere in life. And then we know other people who have accumulated a significant amount of trauma, and we're all just looking at them like, how is this person even alive? And again, what it is they're not denying the fact that they have endured trauma. I mean, if someone has done something horrible to you, like they've molested you or something like that, I mean, you really are not going to be someone who wants to deny something horrible like that. But you do want to deny the effect that it's going to have on you. So you want to deny the effect that people are saying that okay, you've been traumatized, and because you've been traumatized, you're going to carry this around the rest of your life. And you're going to need to take this medicine. You're going to need to speak to these people. You're going to need to live a completely different life. That's not the way, that's not the mindset that I think that you should have. I think that you should, have the mindset of, okay, I have been traumatized, but I'm not going to let this affect me going forward. I'm still going to be in control.
Yeah, I think that's really important to highlight. And I just wrote down here, taking more of a narrative therapy approach. And something I've seen working with people is that coming from the diagnostic framework, it's diagnoses are really helpful for identity. And I definitely saw this a lot when I worked with teenagers. Really attaching to their mental health disorder, it almost gives them a sense of purpose and how to act. It's well, I'm depressed. I'm never going to get better. I went through this thing, yes, and so I'm never going to get over this. But coming from, what you're saying, I'm thinking about just from a narrative therapy approach of we can change that, right? It doesn't need to be stuck. Yeah. We can say, hey, this has happened, but how can we actually build resilience here and move through it?
Yeah, I think we've approached mental health all wrong. I think that, the fact is that people think that, it's good that we're talking about mental health all the time. For the most part, it's actually been detrimental. It's been the worst thing that we could have done. Even things like Bell, Let's Talk and all this, all it's doing for the most part is it's giving people an excuse. They're saying that, oh, I have a mental health disorder, and because I have a mental health disorder, I'm not able to do so and so. It's a cause and effect thing, which is not correct. We should not be, putting that into people's heads that, like, if you have this, if this happened to you, then this is the way that you are going to be. That takes away all the power from the person. They have no personal power then. Basically, what they're stating is that their whole life then has already been predetermined. If you're saying that your past is going to affect your future and there's nothing you can do about it, then that takes away all of your personal power. All of it. So the way that we should be approaching mental health is that, okay, if something happens to you, fine, it's okay. We want you to look at it objectively. We want you to understand that something bad happened to you. We don't want you to deny the fact that something bad happened to you. What we're saying is that you're going to deny that even though something bad happened to you, that you are going to have your life predetermined for you now. No, your life is not going to be predetermined for you because something bad happened to you. And there's millions of examples of people out there that have had the worst things happen to them, and they end up being amazing people. In fact, I would say the people who end up doing the most in life are almost always the people who have had the most trauma. So we need to get away from all this mental health bullcrap that we've put out there the past few years. We need to start telling people that their trauma does not define them and that they still have all their personal power, and that if they don't want to be depressed, if they don't want to be anxious, that's something that they can work on themselves. They don't necessarily have to even be prescribed a medicine. We need to give people their personal power back.
What would your take be on, I guess, the biochemical narrative of mental health? That there's a chemical imbalance and I need this medication to actually get by?
Yeah, no, that's a really good question. I mean, for the most part, like the SSRI narrative, for the most part, has been dismantled. A lot of top psychologists and psychiatrists do not feel that the serotonin hypothesis was ever something that was ever real. And the fact is that a lot of people who take SSRIs do not, in fact, do better. And if it was as simple as, okay, I have a chemical imbalance, all I need is a pill, well, then those people would obviously be fixed with the pill, right? So again, I'm not saying that there's nobody who falls under this category, but like it's probably less than like 5% of people, but I'm not saying, again, it's no one. I mean, we're all different. Like we all have different builds. Some people are tall, some people are not so tall. Some people get diabetes more easily than others. Are some people more likely predisposed to depression, anxiety, or PTSD than others? Absolutely. I'm not denying that, but I'm just denying the fact that if something happens to you, do not use that as a crutch, and do not think that because trauma happened to you that your life is going to be predetermined. But are there people who potentially may have a biochemical imbalance? For sure. And on that note too, I mean, it's not just like psychiatric drugs, like SSRIs or SNRIs or whatever, we're talking about. There's other medications as well. Like I'm a very big believer in hormone replacement therapy, both for men and for women. I think that can have a dramatic impact on someone's overall well-being and their mental health. And, that's something that probably should be tested a lot more when people have depression. I have lots of women who are menopausal, and I correct their hot flashes, but they'll tell me, what, man, my mood is way better. My energy's better. I'm sleeping better. Everything is better. So again, I'm not saying that you can't have, some type of biochemical deficiency, but you definitely can. And I'm also saying that don't limit it to just, these classical psychiatric drugs. You might have a deficiency in hormones or deficiency in something else that's caused depression.
So I'm coming back to our breathwork teacher, Lenny Gibson, who often talks very similarly about trauma the way you just did. There's some film that we watched at his place in February where it was a lot of psychedelic experts talking about trauma in this kind of, it's a very strong predictor of your future kind of thing. And Lenny is just very against that and personal power. And he used the term agency. It's more about agency, because how do we keep people strong and engaged in their lives and understanding that they have personal agency. It's not the spirit of ayahuasca. It's you. It's not your psychiatrist. It's you. It's how do we build people up? And that's one of the fundamental things we like about holotropic breath work and our form of transpersonal breath work, where there's no drugs. It's just you doing work and this stuff happens.
Yeah, exactly. You are doing the work. And when you do work and you can see the work, that gives you personal power. And also too, it creates momentum in your life. You're like, oh, I just breathed and I feel so much better. Maybe I can, anytime this happens again, I can do this again. Now I've learned this skill of like breathing. Like, what else am I missing out on as well? And I also find too that, when people do find something that works that they didn't think would work before, say something like breathing, or for someone, it might even be cannabis, they'll start looking at other parts of their life. They'll be like, oh man, like maybe I was lied to about nutrition. Maybe I was lied to about fitness. Maybe I was lied to about spirituality or whatever it is. It seems that, once you get that personal power and you gain it yourself, you do it yourself, then you have more of an ability to look at other avenues and look at other things in your life that you could change as well. And like for yourself, I mean, you got a whole pile of books in the background there. I mean, I'm sure those books, it helps you a ton too, That's a lot of personal work to go through all those books. So.
This one just came to mind as you were speaking. It's from it's all backwards and stuff. You Are Being Lied To is the title. It's like a collection of essays about just crazy stuff that's not true that you were taught. And, it was inspired by Timothy Leary and a number of other kind of psychedelic people, that press. And I've been pretty interested in it. And, coming back to psychedelics and Tim Leary, think for yourself and question authority. That's like two big items of work that are very helpful for people if you start to, question official narratives and think for yourself and understand intellectual rigor as well, because it's easy to slip off.
Yeah. Don't get angry with that. That's the thing. Is like if you find out something and it's like not true, don't lash out in anger. Do not lash out in anger. Stay calm and just focus on gaining the right information. Like what you're trying to do, like think about what your goal is. Your goal is to find the truth, to find the right information, and to make yourself better, to help yourself and help others, spread good information. Your goal is not to get angry and spread all this bad energy to everyone and say that we've been lied to, all this stuff. And we want to get away from that. We just want to make sure that we're focusing on the positive aspects of it, because I do see some people, in the cannabis industry and in, the industry that we're kind of in where people just kind of, all they're doing all day is talking about how doctors suck, how doctors don't know anything about cannabis, don't know anything about drugs, where everything in the system's bad and all that sort of stuff. You don't want to go down that road. This is a positive thing. This is a positive place. We want, that's the type of mindset that you want to have, is you want to seek the truth. You don't want to necessarily be right. You want to just find out the truth. You're not trying to make anyone else look bad. You're trying to make yourself better. You're trying to make the people around you better.
Wonderful advice.
Agency.
Thanks, brother.
How do we become masters of agency eventually? That's the real thing. And it's a long project, and good relationships and just a good life. We're not here for a long time. We're here hopefully for a good time and, helping everybody as well.
Yeah. I always try and line up those three things in my life. I think those are the most important, is your relationships and your job and your health. You have to have those. They're not always going to be, all three aren't going to be perfect at once. It's pretty hard too. And if you are in that situation, enjoy it, and I'll also understand that disaster probably will come, because if you have all three of those perfect, something you're doing a lot of things right, but you're also probably having a lot of good luck too. But you never want to let any of them slide off too much. So they all got to be pretty stable, but the fact that they can never be perfect is fine. But you don't want your health to get too bad. If you get a little bit out of shape, you can get back into shape. If you get way out of shape, man, it's going to be too big of a project where you're going to have to negate your work and your relationships for a period of time, just because it's going to take so much work. Same with like your work. You want to make sure that you're making decent income. You want to make sure that you're doing something that you enjoy, but at the same time too, you don't want it to take up your whole life. And then lastly, of course, relationships are so important. Your romantic relationship is important. Your family relationship is important. Your friendships are important. So you want to keep some type of balance there as well. So always something that those three things I always try and keep in mind, and I think about almost daily.
Yeah, and I think something you said, just kind of coming back to mindset, like even just talking about being in the industry and being like, oh, doctors suck or this sucks, but like coming back and how do we be grateful for, the things that are in front of us. And I think that even goes a long way within those three domains as well, right? Like we could sit here and say, oh, this is not perfect, or oh, this sucks, but how do we like come back and be grateful for whatever's in front of us and try and find the beauty in it, right? And if it's terrible, I mean,
Yeah.
that's a sign to make a change, but how do you at least just have a little bit of gratitude for everything?
And I think that we're all, experiencing in some ways more gratitude these days, just because, we've been cut off from so many things that we're used to having. No one can travel anymore. People aren't going out eating at restaurants. Those are things that a lot of people like to do for pleasure, for entertainment, for socialization. And having those things, taken away from us, I think does, make you more like grateful. So on that point too, that's a very good technique for becoming more grateful for things that you may have been taken for granted. Is that when you go without them, and you realize, how lucky you actually really are.
I noticed we have about, 5-8 minutes left. So I wanted to see if you wanted to touch on it. Before we got recording here, you mentioned that you also prescribe and use ketamine in your services. And I wonder if you could touch on that a little bit. I'm sure that might be interesting for the listeners.
Sure. Great question. Thanks for asking. So yeah, I've been prescribing ketamine now for just over a year. The reason being is because, again, a lot of people suffering from mental health. Also, to a lot of people suffering from chronic pain. So I'm a big advocate of cannabis. But again, cannabis is not going to help everybody. Like some people, are in certain states in their life where, they need something stronger than cannabis, need something different cannabis. And, I have found that in my practice, ketamine has been really effective for a lot of those patients, especially patients with treatment-resistant depression. That's where most of the studies are on and its biggest indication. Now, for most people, if you look at the studies, they'll say that, a lot of times it's given IV. And in the States, I think right around this time last year, actually, there was a drug that has been approved called esketamine. So esketamine is ketamine that's given intranasally. So that has not been approved in ketamine. The way that I prescribe ketamine is I give it orally. So I have a compounding pharmacist make up the ketamine and I prescribe it orally. And generally speaking, the way I prescribe it is I give patients 75 milligrams 3 times a week. Now, I always tell my patients that they should take it in the morning on an empty stomach. Because if they take it in the morning on an empty stomach, they can get a bit of a dissociative effect. So ketamine kind of wrongly often gets grouped as a psychedelic medicine. So, like LSD and MDMA and psilocybin. So technically it's not a psychedelic. It is a anesthetic. But if you take it like I prescribe it, like I said, you can have somewhat of a psychedelic-like experience. And I believe that it's part of that psychedelic-like experience and that dissociative effect that people actually do get benefit from the medicine. So, a lot of people, they just absolutely have never had like a break in their life, in their brain. Like even when they wake up in the morning, as soon as they wake up, something's going on in the brain. They just haven't had like a break. So I feel that, for a lot of people, like just that small break that they get for about 30 to 40 minutes, sometimes less, can be really effective for treating their depression. And then also too, I mean, I've had results. My results have been so good with this that, I've been published for this too. I've had 3 patients in a case series that were published for this in the Journal of Behavioral of Psychiatry. So I do think that it's a very effective medicine. I've seen it work in my practice very effectively for depression and also very quickly. So, as soon as patients take it, they can feel it, like right away. So, that's a big difference between starting someone on an SSRI, like a selective serotonin reuptake inhibitor, where they're often told that it's going to take at least 4 to 6 weeks to kick in. This will work right away. So, I've been, very happy to have that in my toolbox, and I've been very happy with the results of my patients.
Yeah, that's awesome. And are you like having a session with them first, or is it just prescribed and like they can take it home?
So we go over, how to use the medicine one-on-one, and then also to the compounding pharmacist that I work with also goes over how to use the medicine with them. And then they're also followed up with me, very, very quickly. So, I see a lot of those patients like once a week even, just because I want to make sure that things are going okay. But on your question, that is something that I have looked into, and we will be offering ketamine-assisted psychotherapy at some point as well.
Awesome. Yeah, I don't know if you follow the Korea Institute and what Dr. Raquel Bennett's doing over there, but I mean, it sounds like this is an industry that's kind of taken a hit, especially with like infusion clinics, and I think some of them have adapted a little bit to what's going on right now. But Raquel put out a statement saying like, yeah, if you're a ketamine provider, try to do at home, oral lozenges to at least get those clients the benefit. And yeah, it's interesting to see the people that have been doing ketamine assisted psychotherapy kind of have to change their protocols. And I'm really curious to know how that's really working for folks. But it sounds like that's something you've been actually doing in a sense of prescribing, allowing people to take it as a medication on their own.
Yeah, I mean, you can definitely, get some benefit from using it with like a psychotherapist, like you said, but there's definitely some benefit from using it on your own. I mean, oftentimes, and again, like with most of my patients, I actually do have someone watch them so I always recommend that. But at the same time too, even if someone is watching you, that doesn't necessarily mean that you don't feel like you're on your own and that you can't have like your own experience. And for some people, that's better than say being in like a group setting and having someone around, because they just feel most comfortable completely on their own, which is, understandable. And that's what a lot of my patients tell me as well. They're like, I don't want to be, unless it's someone who's very close to them. Again, like I always recommend having someone close to you, but they don't want to be around, people who don't know them if they're going to be disturbed, which I understand.
I don't.
Yeah, exactly. So I mean, I hope that, the patients who are doing it IV, if they can't have access to it IV, I imagine that, they may be surprised at how well they'll do on their own.
Yeah. Do we briefly want to mention anything about cannabis and COVID before we wrap?
Sure. I mean, unfortunately, at this point, there's no like RCTs or, randomized control trials on cannabis and COVID. There's nothing that can like indicate that, it can help. But there are trials underway looking into, cannabis, if cannabis can help. I don't think it's completely ridiculous to look into trials. I think it's ridiculous to say that, cannabis can cure the coronavirus or anything like that. It can't. But, the fact is that cannabis does modulate your immune system. We do know that the coronavirus is, for the most part, something called cytokine storm. So that's the thing that's, it's an over stimulation of your immune system. And the fact that, cannabis does have an effect on your immune system, I think, that's a reasonable thing to look into. But so far, we don't have any data suggesting that cannabis is effective in any ways, but, let's definitely keep our eyes peeled for that research.
And any kind of warnings for heavy cannabis smokers, or is it, no, you're not seeing a correlation there, or where do you stand?
Well, I mean, no, it's a good question to ask, because this is a lower respiratory tract infection. So, the common cold, you probably hear all the time, is upper respiratory tract infection, which again is, the reason why it's not as fatal as a coronavirus. Coronavirus is the lower respiratory tract infection, and there's an enzyme called the ACE2 enzyme, and that's what the glycoprotein from the SARS-CoV-2 attaches to in the lower respiratory tract, and that's what can cause the respiratory issues. But the reason I say this is because I did hear Dr. Peter Hoyt say on the Joe Rogan Experience that smoking, and I'm not sure if he was be specific to tobacco, though, saying that smoking can increase the expression of that enzyme. So it would be best to, stay away from smoking. So, my suggestion would be that, like, this is a respiratory illness, and we don't know too much about it. So stay away from anything that's detrimental respiratory. Right. So whether it's smoking, vaping is likely to be, less harmful, but anything that can cause any type of respiratory damage, stay away from, because it's a respiratory disease. I think that's just good common sense.
And edibles last longer anyway. So
yeah, you can always use edibles if you are having difficulty getting switching from smoking and vaping to something else. It doesn't have to be cold turkey. You can absolutely use edibles, and that'll make the process a lot smoother and cleaner.
Great. So I think that's a good place to wrap. Can you tell our listeners where they can find you online?
Yeah, well, first of all, thank you so much for all your listeners for listening, and to you guys for having me on. I really do appreciate it. My website is mikehartnd.com, and I'm pretty active on social media. So I'm at Dr. Mike Hart, DRMIKEHART, on Facebook, on Twitter, on LinkedIn, Instagram. So I'm on all of it. So please follow me there and check me out. And hopefully you guys enjoyed this. And if you did, then hopefully I'll be back on sometime.
Hope so. Hope we can make it happen again. Thanks for your time.
Okay. Thanks so much. Really appreciate it, guys.
And there you have it. Dr. Mike Hart, Canadian-based physician with expertise in cannabis and psychedelics, nutrition, and much more. I hope you check his website out and follow him on social media. Very helpful stuff. I've really appreciated it. So I think that's it for that topic. Again, we'd really love for you to check out Navigating Psychedelics for Clinicians and Therapists. If you know any friends that need to get prepared for this coming wave of psychedelic use in clinical, recreational settings and more, it's worth getting prepared. Tell your friends about it. We'd really appreciate that. And you can learn more at psychedeliceducationcenter.com, where we've got free classes and plenty more. I think that's it for now. Really appreciate you all listening. This couldn't happen without you all listening. So thank you for that. Hope you've been enjoying the Friday episodes. And yeah, I think that's it. Joe Moore signing off for Psychedelics Today from Breckenridge, Colorado. Bye-bye.